Good afternoon, everybody. In today's polluted, high stress world, lung health is under constant threat, even for non smokers. Add to that the silent nature of lung cancer symptoms, and it's no surprise that it often goes undetected until it's too late. But here's the good news, awareness can save lives, and that's exactly why we are hosting this session today to empower you with real practical knowledge on early signs, prevention, and what steps to take next. We have expert with us, Dr. Karthik Prasad. Dr. Karthik Prasad is a renowned oncologist with 18 plus years of experience, specializing in cancers such as head and neck, lung, typhoid, breast, and gastric. He is skilled in advanced procedures like Whipple's surgery and lung resections. Over to you, Dr. Karthik.
Yeah, yeah, yeah. Good evening, everyone. It's good to hear that we've been hosting a lung cancer awareness session. Today is the World Lung Cancer Day. The main importance of this is to create an awareness. So we hear a lot of cancer cases now. Almost like one in every family, we see a cancer cases. So today's talk, I'll be just giving you an insight into a cancer. So, can we pick up the symptoms early, and what are the early stages we can diagnose, and what are the treatment options we have? So, my presentation will be around 30 minutes. So, 10-15 minutes we can have a discussion. So, coming to what is cancer actually exactly? It's an abnormal and uncontrolled multiplication of a cell, so which goes out of control and which forms a tumor. So, finally, that tumor transforms into a cancer. So, what is the characteristic feature of a cancer to say it is cancer is these abnormal cells invade the neighboring tissues or the organ. So, what we call it as a metastasis. The cancer always spread to the other organs or the neighboring structures, whereas a simple tumor may not spread to the other parts of the body. So, just to introduce to the what are the stages of cancer. So, we have four stages: stage 1, 2, and 3. And the fourth stage is called as the last stage or a metastatic stage. The example here we take of a breast cancer. Say if the tumor is confined only to the breast, so we call it as an early stage or a stage 1. So if the tumor has spread to the regional station, we call it as a next station. So we call it from the breast node which has spread to the axillary nodes. We call it as a stage 2. Even stage 2 is considered as an early breast cancer. Stage 3, when we have a tumor slightly bigger in size, we say more than 5 centimeters, and we have multiple station 2 nodes. Axillary nodes are multiple. We call it as a stage 3, or it is called as a locally advanced cancer. And the stage 4, or the last stage, or a metastatic disease, we call it, wherein the breast cancer has spread to the different organs, probably a brain, lung, liver, or bone, or to the multiple organs. So we call it as a stage 4. In India, the scenario is the most of the cancers are diagnosed in the stage 3 and stage 4. So that is why we bank on early diagnosis and the screening. Because once it crosses the early stage and it is diagnosed in stage 3 and stage 4, the treatment options are you may require surgery, you require chemotherapy, you require radiotherapy, everything. The overall the outcome is very poor and the survival is also very less. So why it matters? See, cancer is a major health concern worldwide, being the second most common cause of death globally. See, after the cardiovascular MI, cancer has become the second most common cause of death. See, if we look at the scenario, see, almost like one third of the cancer related deaths can be avoided just by a simple routine checkups, early detection. Just somebody has to be aware of, say, from the age of 40, you do an annual health checkup. Suppose the lesion is developed very early, it can be completely cured. You are completely cured of cancer. Say, for example, we say breast cancer. So in India, the average size of a breast tumor detected is around when it crosses 3 centimeter, whereas in US it is around 5 millimeter to 1 centimeter. So once if it is picked up in an early stage, probably the treatment is also a simple. A simple surgery would cure the cancer completely. And as I mentioned, the cancer cases is also on the rise. So, as per 2022 data, India has the third highest number of new cancer cases in the world, which is after US and China. India stands the third. The crude incidence around 100 per 1 lakh people. It is estimated that by 2040, the incidence is going to double. Even though it is a statistics, but definitely the cases are going to rise. And it means that 1 in 9 people in India is likely to develop cancer in their lifetime. So if we look at the scenario, like what are the cancers which is common, say in males and females. Coming to males, you see it is more of a head and neck cancer, lip and oral cavity, which stands the first. Second is the lung cancer. Third is the esophagus and the colon and rectum. See, we look at the distribution, it is more to the lifestyle, the use of tobacco and smoking. And in coming to females, we see breast cancer, which has overtaken. Say probably 5 or 10 years down the lane, it was the cervical cancer, where we see more related to an hygiene and infection. Now we see more of a breast cancer, that too more common in urban women. The second is the uterine and the ovarian cancer. It's probably a lifestyle. We see a lot of when 10 years back, when compared to the West, so there was 85% of the Indian women did not have any of the risk factors. So there was no history of smoking also. See, in the 10 years, probably the lifestyle and urbanization, we see more late marriages, breastfeeding issues, and also the smoking, which has been more common in now in females also, and we see more of couples smoking also these days. And coming to the risk factors, we all know, see, it's mainly the lifestyle, the tobacco and alcohol, which is the major concern, and unhealthy diet. So probably it's the metro life. So you have no time at one click you can order the food, and also the physical inactivity. So probably what we say, we travel in the metro and the public transport, that itself will not, is not equal to the exercise. The other is the exposure to the pollution and chemicals, all those things. What factors which we cannot change is the age and the sex, and the family history and the genetic makeup. So coming to the what are the early signs of the cancer? Can we pick this cancer in an early stage, or what are the signs you have to spot for? Say appearance of any swelling or lump anywhere in the body or in the breast. There's some unusual bleeding, probably in between the menstrual cycles, or bleeding from the rectum, bleeding through the while passing motion, or unexplained weight loss. Or is there any some ulcer over the tongue which is not healing, or a cough which does not subside, or is there any sudden onset of difficulty in swallowing or breathing, or is there some black mole which has suddenly increased in size or changed in its character? See, most we listen that see most of the cancer do not have any signs or symptoms. By the time it is diagnosed, it is a stage 4 cancer. See, I don't agree with this statement saying that it has no symptoms or it is diagnosed at a stage 4. 20 to 25% may not have any symptoms, but 70 to 75% of the cases do have symptoms. We recently had a patient, 67-year-old, coming with a stage 4 kidney cancer. So he had blood in the urine previous night when he passed urine. So he next day morning immediately has come to the hospital saying that he passed hematuria, we call it, blood in the urine. So when he was evaluated, he had a huge kidney tumor which has spread to the liver, lungs, and to the bone also. He said he had no symptoms except for the yesterday he had a episode of passing blood in urine. But when we carefully evaluated him, he was telling that probably 6 months he had some fatigue. He used to feel tired. Before he used to walk for 30 minutes or 40 minutes. Now at 15-20 minutes he used to get tired and he used to take rest. So when we inquired in their family also, they were like, yeah, he had got some blood test done 3 months back, which showed hemoglobin was 9.5. Then we asked them, was he evaluated why hemoglobin is low? Then it was like, no, he was 67 anyway. We don't expect 10, 12 grams of hemoglobin. So it would be 9, around 9 and 10 is fine. So then when we inquired her wife also, he said, yeah, he used to eat 3 to 4 chapatis. Like from past 1 or 2 months, he's eating only 2 chapatis. So when I told no, he had removed his all his tooth. So he was waiting for the dentures. So his diet has come down. So at every point he had few symptoms, but nobody evaluated him. So usually there would be some symptoms which maybe mimic your day-to-day activities. Probably it is like you say, it may be related to your work. But if there is something which is persisting, any symptom, so okay, Monday or Tuesday, there's a lot of work, so you may feel tired. But if the symptom is persisting for a longer time, any symptom, so that requires evaluation. Suppose you say we might have experienced that a cough, we had a very bad cough, we took antibiotics, the 2 bottles of syrup is over, but still the cough is not gone. It's 2 weeks. Somewhere third weeks, there's some decrease in your intensity. Somewhere by end of 4 weeks, nobody remembers when the cough disappeared. Suppose the same cough which persists for a longer time, any symptom for that matter, which persists for a longer time, that needs to be evaluated. So we need to be aware of our own body. See how do we notice any change, or is it the same? That interest has to be taken care. See what I find these days is that we are so much obsessed about the vehicle, car, all those things. So we don't want to miss the service of the first service or the second service. Even a slightest change in the noise in the engine, we go to a mechanic and see that it is corrected. But the same interest we don't take when it comes to our own health. See, we just start with before going into the lung cancer. This is one of the very common questions I came across during the treatment of cancer. Doctor, my father is 70-year-old, so he's been diagnosed with stomach cancer or a breast cancer. My mother, my aunt. So should I treat his cancer? So he's 70 plus. He's 80. He's nearing 80. Should I treat? Will he tolerate surgery, or will surgery make him bedridden, like that? See, firstly, it has to be evaluated. See, age is not a limiting factor for the cancer treatment. You think that at age of 85 he is healthy, he is able to do his routine work, what we call it as a performance score. His overall fitness is good. He is able to manage on his own. Suppose he had no cancer, he's going to live for next 5 years or 10 years. And if the cancer is detected in an early stage, then I think it has to be treated. So age is not a limiting factor. If there is a chance of cure, he should not be denied of the surgery or a cancer treatment. So it said that it's not how old you are, it is how you are old. That is what is more important. Probably a proper planning of a surgery, improving his nutrition, strength, improving his lung capacity, heart functions, and lung functions. If there's some low hemoglobin or low protein, treat that. And also the counseling, which is very important when it comes to uh, treating cancer cases, mainly in the elderly. And also the to have a realistic expectation. See, probably you cannot say he'll be 100% fine. Probably reaching up to the 70-80% of his normal life is also equally good. So on this day, where the World Lung Cancer Day, so we'll just have some insight about the lung cancer, like what are the causes, so how do we detect early, and what are the treatment options. So lung cancer, again, it's the most often diagnosed cancer, and it is the leading cause of cancer-related deaths worldwide. So in India, lung cancer accounts for 5.9% of all cancers and 8.1% of all cancer-related deaths. Again, the smoking in patients with lung cancer, nearly 80% have a history of smoking. So coming few of the facts, we say India is the second largest consumer and the third largest producer of tobacco in India. Approximately around 28% of Indian population consumes tobacco. Again, as per the National Cancer Registry Program, the tobacco related cancer constitutes around 27% of all cancers in both in males and female. So what exactly is this lung cancer? So it is something, some abnormal cell which grows in the lung. What we call it is a lung parenchyma. So which multiplies and forms a bigger in size. So which might interfere with your breathing, or when it spread to the other parts of the body, you can have other symptoms. So what are the two main types of lung cancer? We call it as a non-small cell lung cancer and a small cell lung cancer. Non-small cell lung cancer, again, we call it more common, which is the adenocarcinoma and a squamous cell carcinoma, which is based on the cell types. As per the pathological classification, we have more than 100 types of subtypes of lung cancer. So the what are the causes? When we come to the what are the causes for lung cancer? Again, main is the smoking. We say, as I mentioned, see 80 to 85% of people with lung cancer have a history of smoking. So it is the amount, the intensity of smoking. So probably you have a one pack or two packs of cigarette for a period of 5 years, of 10 years, then you have a significant history of or a risk of developing a lung cancer. Say we see a lot of youngsters these days, like yesterday my friend somehow he forced me. I had a cigarette yesterday. Next day they come to clinic, sir, do I yesterday I smoked cigarette. Do I have lung cancer? Can you just screen me? Or a person who has been smoking for 10 years, are both the same? We say, we label them as a smokers? So it's like, as per the NCCN protocol or the definition we call it, in your lifetime, suppose you have a history of smoking more than 100 cigarettes in your lifetime, then you qualify as a smoker. That is an arbitrary risk point where there is some structural changes within the body and which increases the risk of developing cancer. And what is passive smoking? Probably you are not a smoker, but you are always in a company of people who are smoking. So indirectly, you are also inhaling the smoke. So that also, these days there is a significant increase in the lung cancers in the passive smokers also. And the third most common, what we say, is the air pollution. See, most almost like one fourth of our time is spent in traffic or in the outdoor, where you are exposed to a lot of smoke, chemicals, all those things. There's definitely a significant risk. And the occupational carcinogens, probably a cement factories, asbestosis, or a diesel exhaust, we say hydrocarbon inhalation. So all these things are lead to an increased risk of developing lung cancer. The other thing is a genetic and a family history. These things which cannot be changed. Coming to smoking, see why it is so much stressing on smoking and this thing. See, smoking can cause almost like some 15 to 16 type of cancers in a human body, not just a lung cancer. You name an organ, the smoking causes cancer. It can cause oral cavity cancer, it can cause lung cancer, it can cause esophageal cancer, it can cause stomach cancer, it can cause a larynx, what we call as a voice box. It can cause renal cancer. It can cause blood cancer. So it's the intensity of smoking. That is what is decide whether you have a what exactly does it is. See, once you cross the threshold, something called as a field cancerization we call it. There is will be a structural changes inside the thing. So even a smallest amount of chemical that is able to transform itself into a cancer. So once we come to the smoking, we usually measure the risk factor in terms of pack years, we call it, which is the measure of person's smoking history, indicating the total amount of tobacco smoked over a time. We calculate as a pack years. It is the number of cigarettes packs per day multiplied by total number of years the person has smoked. It's just like a smoking history. Suppose a person has one pack per day for 20 years. We call it 20 pack years. So we consider one pack to have 20 cigarettes. Suppose the same person smokes 2 packs per day for 10 years, so he'll have a risk of 20 pack years within 10 years of time. Suppose the same person has 5 packs of cigarettes per day for 4 years, so he'll qualify to have a 20 pack years, which 20 pack usually we consider as a significant. Even though now we see a lot of the other added environmental factors also, for smoking we usually consider as a 20 pack years. See, what is the other important thing with smoking is, so it is again the intensity of smoking and number of years the smoking has been thing. So only thing, even you quit smoking, the smoking will not leave you. Recently, we had one school teacher. So he's been a smoker for almost like 20, 30 years. So he retired at age of 60 and he decides to quit smoking. So last week when he came, he was 74, 74, 75. So he had developed a laryngeal cancer. It's not that, say, today you quit smoking, tomorrow you're not developing a cancer. So you have a history of smoking for 20 years. Even you quit today, the risk remains for the next 20 years developing cancer. The other important thing is about the smoking is the addiction. See, how do we say that a person is addicted to smoking? We say person who has a history of smoking for say years, 2 years or 3 years or 5 years. The morning he gets up, say morning 6 o'clock he gets up, so he'll have his first cigarette with his colleague in the office around 10 o'clock or 11 o'clock. Okay, good. Somebody gets up at morning 6 o'clock, he has his first cigarette at 6:30. Between that time, he is very restless. He is unable to talk or do nothing till he has that first cigarette in the morning. Then his all his day-to-day routine starts after that peacefully. This is the measure of addiction, getting up in the morning and to the first cigarette. If there is a very short interval, then that is the person is very much dependent on the smoking. Do even non-smokers develop cancer? Yes, there's data saying that Asian population, mainly the Asian women, they have a history of developing lung cancer. Say 30% of lung cancers in Asian population have no history of smoking or tobacco usage. So 50% of Asian women with lung cancer have never been exposed to tobacco. The major attribute, again, it is a genetic. Probably it's a geographical and the genetic. We had one patient in Pune where I did my surgical onco training. She was around 55. So she had just come for a routine checkup for cough. So when she was evaluated, she had a stage 4 lung cancer, no symptoms. So it was somewhere in October, November. Her daughter's wedding was in February. So she was like, somehow 3 months if I survive, that is fine, sir. Somehow that, because it was almost like spread to the bones and other part. Somehow like with the chemotherapy, with the newer targeted therapy, everything. So she was fine for 6 months. Again, there was a relapse. Again, she had to continue chemotherapy. She was almost there for almost like 1 year, 1 to 1.5 years. So usually the lung cancer, it develops as a nodule somewhere in the lung, maybe in the middle or the upper lobe. So what are the symptoms? What do we expect? It is something like persistent cough. So usually the smokers have cough. Something, there is a change in the character of the cough, or there may be some blood in the sputum. You had a cough, very bad cough, but now you see streaks of blood in your cough. So that is a sign of danger. Or you have shortness of breath. Before you used to walk for 15 minutes, now you take 10 steps, you're tired, you need to be rested, again you walk. So that requires evaluation. Any lump in the neck, so there's some swelling appeared in the neck, so that requires evaluation. Or there is a persistent bone pain or a chest pain which is not going in spite of taking analgesics, all those. There may be a change in voice. So you get it evaluated by the ENT. They say throat infection. So 15 days over, 20 days over, there is no change in the voice. There is no change. Still, there is a voice change. Or there is headache. So, or unintentional weight loss, any of these symptoms. So that requires evaluation. So unfortunately, a patient with these symptoms usually have an advanced cancer, lung cancer. That is why, I mean, to pick up at an early stage, it's always very difficult. You probably even a slightest change or something, a cough is persisting, that requires evaluation. So, what are the diagnostic tests we have? Coming from simple x-rays, probably we do a chest x-ray, we do a CAT scan, CT scan, a bronchoscopy, a biopsy, or a sputum cytology. The simplest is always a chest x-ray. We do a chest x-ray, suppose everything appears gray and black, it's fine. Or there, if there are some nodules you see on the other image, some round nodules in the lung, that requires evaluation. The next, after the basic chest X-ray, next is the CT scan. What we call it is a low dose CT scan. Probably we look back during the COVID time where we used to do a CT scan only. Instead of an X-ray, the basic modality was a CT scan. Lot of lung cancer cases were picked up. The lesions were 2 centimeter, 1 centimeter, or 3 centimeter. Patient had no symptoms, but a lot of lung cancer cases were picked up because doing a CT scan was a screening modality for lung cancer. What is the other advantage of doing a CT scan is the same time we can do a biopsy using a needle. Some biopsy of the lesion can be done. So you doing the CT, you target the lesion where exactly the lesion is and you take a biopsy. So this by doing a biopsy which will tell us exactly whether this is cancer or not. So once it is cancer is confirmed, then you need to do a scan, what we call it as a PET scan, to stage the cancer. Is it in an early stage or it has spread to the other parts of the body? The staging will. See, other modalities are bronchoscope. Suppose the lesions is in the center part of the chest. As you see, it is close to the central part, what we call it as a trachea and the bronchus. So you pass a tube through the nose, you enter the voice box and the trachea, and you take a small biopsy from a piece from the tumor. So once we have a tissue, so that is being examined by the pathologist under the microscope, and we get a diagnosis there whether it is cancer or no cancer. And what is the cancer? Is it adenocarcinoma, squamous cell carcinoma, and what is the subtype, and what is the genetic makeup? So what are the mutations we see? So this will guide us in the what is the prognosis of the cancer, what kind of treatment would help, does it require chemotherapy? Does it require targeted therapy? Does it require immunotherapy? Or it is a surgery, the treatment of choice. Coming to the again the staging, it's again very simple. Stage one, confined only to the lung and very small disease. Stage four, disease is very big and it has spread to the multiple parts of the body, not just only the lung. Probably from the lung, it has spread to the brain, it has spread to the liver, it has spread to the bones. Stage two, again, it's a slightly a bigger disease compared to the stage one. Stage three, again, it's an advanced disease where you have a big disease with multiple lymph nodes, or it might have involved the other side of the lung walls. So, what are the treatment options we have? Mainly for the lung cancers: surgery, radiotherapy, chemotherapy, targeted therapy, immunotherapy. We have metronomic chemotherapy, what we call it as a tablets also. Coming to the surgery, so surgery is always a curative treatment. So a very early stage where the disease is only confined to the lungs only. So probably you can remove a half of your lung or one side of the lung or a small wedge resection. A small part of the lung is removed. So previously it was like a open surgeries where you had to open up the complete chest, break the chest bone, enter into the lungs, remove the entire lung. Now, with so much advances with the keyhole and robotic surgery, with the smaller incisions, we can do a complete removal of the lung and faster recovery and also less painful. Radiotherapy mainly for the advanced cases, probably from stage three. The treatment of choice is radiotherapy, where the patient is asked to lie down on a couch and a beam of radiations which run through and which will target the specific area of the tumor. See, other is again the chemotherapy. You have multiple drugs based on the type of cancer. So where you require to take for 4 cycles or 6 cycles every 21 days of cycle. So the lung cancer, again, coming back, it is one of the most commonly diagnosed cancer worldwide, and it is leading cause of cancer deaths. See, as an oncologist, we are more worried about the cancer deaths. See what we can see when we look at the incidence and mortality. We say the breast cancer incidence around 26%. We see mortality is 13%. Uterine cancer, 17% is the incidence, 11% is the mortality. When you say lung cancer, it is around 5%, 5.8. Again, the mortality is 5.3%. See, we see the incidence and mortality. The mortality is almost like 50% or more than 50%. Why is this? See, most of the cancers are diagnosed in the very advanced stage, or a stage 3 or a stage 4. Say, we say every year there are 1 lakh cancer cases are diagnosed. The 50% of the cases are patients are dying of cancer because by the time they reach the hospital or they seek for help, it's already an advanced stage. You cannot do much. The main purpose of having a World Cancer Day or a World Lung Cancer Program is to create awareness. So, because once it is diagnosed in an early stage, stage 1 or 2, the treatment is simple and survival is say around 80 to 90%. Once it is stage 3, survival is only 65%. Suppose it is a stage 3, stage 4 disease, only less than 25% people survive. So, how will it affect our lives? So, the World Cancer Day, the theme was, so cancer will turn our world upside down. So it can change your perspective on everything, the life, relationships, and future. We had a lot of patients. So recently we had one TV anchor. She had just a swelling in front of the ear, which was there for a longer time. So she was just like getting married in another 3 months. She wanted to get it removed. So when we did a surgery, finally it turned out to be a cancer. Now the question is like, should I wait or should I get married? I don't know what is the thing. So probably see, you may be in your important part of your career or your life, or maybe entering into a relationship, something. So it is important that you be aware of your health. See, the only way you can change these numbers is by increasing the awareness. You need to be aware. Okay, there is some change, something wrong, which requires evaluation. So which needs some doctor or an oncologist to diagnose and treat. So cancer is treatable. The chance of survival is high if detected in time. And the most important in cancer is the timely treatment. It's not that okay, I'm diagnosed today with a cancer, stage 2 cancer. So let me come for treatment after 3 months. No, that is not acceptable. So it is a timely treatment, timely diagnosis, and timely treatment. Then only it is going to help. So it's not that delaying treatment. Again, see, probably you are diagnosed at stage 2. By the time you would start treatment, it would have been stage 4. So only way to be do so is being aware how it can be detected early, early diagnosis. So catch it early and stay ahead. So coming to lung cancer, so who are the people who should be screened? Who are the high risk individuals? Say, I would advise, as per the NCCN protocol, what we call as a National Comprehensive Cancer Network. We say from the age of 40, annual health checkup is important, irrespective of whether you have problems, no problems. From the age of 40, you should have an annual health checkup. When it comes to the lung cancer, so more than 50 years, or people with more than 20 pack years of smoking. So that 20 pack may be 10 years or 20 years, or you may achieve a 20 pack years within just 5 years of time, or people with 20 years of history smoking. Even in case you have quit smoking for more than 10 years and you had a history of smoking for 20, 30 years, these are the people should be screened for lung cancer. So I'll just run through a few of the images. So what all cancers we had operated. So this one, thyroid, papillary CA thyroid in a young female with a small scar. There's a huge thyroid cancer. So we had operated. This is some parotid tumor. where this the white structures what you see is the facial nerve, so which is technically a very challenging surgery where you need to preserve the each nerve which is responsible for your facial movements. This again a bigger parotid tumor surgery done with a plastic surgery is also done. There's a gentleman with he had a small mole over the face. So initially he did not wanted to get it operated. So when it became very big, so he had tried other alternative medicine. So finally we did remove the thing and a plastic surgery was done. He's doing fine. This again a school teacher. So he had a very small ulcer over the left side of the tongue. So so he was afraid whether this would hinder him from the taking classes or something. So post surgery, so this was the half of the tongue was removed and half of the tongue was reconstructed with his muscle from his hand. This was also a lady with a tumor of the thigh. So we had removed the entire bone tumor and reconstructed with a titanium rod. This is a young boy with a 10-year-old with osteosarcoma of the thigh bone. So we had to remove and reconstruct with the titanium modular prosthesis. So we have a newer device now where you can, since he is in this growing age, you can increase the length up to 6 centimeters. The modular prosthesis. We used to. This is the post-op day. He's been walking. So this is a lady again with the advanced ovarian cancer. So disease has spread to all the parts of the abdomen. So usually the stage 4 is difficult to cure. So following chemotherapy, she responded well, and we did a surgery. This is a newer treatment, what we call it as a HIPEC. So we give chemotherapy inside the abdomen. So once everything is removed, there's a good survival also. There's also a medical student with a, again, chondrosarcoma. We say it's a tumor of the scapula, flat bone. So she did an extensive surgery. She had difficulty in lifting up the hand. So we did an extensive removal with a reconstruction with a plastic surgery. So at Spurs, what we do, see, it's important. See, anything, uh, any symptom which persists for a longer time or a suspicion of a cancer, it requires a thorough history and examination. See, other thing is again a biopsy and a imaging. So it is better the biopsy is done by an oncologist. So that will help him in suppose the patient requires a surgery. The planning of a biopsy and imaging is very important. And once suppose it is turns out to be a cancer, again it is important you stage the cancer and treatment as per the standard protocol. So most of the places it is the NCCN protocol we follow, and counseling, which is very important these days, counseling of the patient and also the family members, which is very important, and preparation of the patient. See, in oncology there is no emergency. Probably less than 10% cases there is an emergency, but most of the time it is a planned surgery. So you know everything, and you plan and you prepare the patient for the surgery. And at Spurge, we have a complete cancer care. So once it is diagnosed, we take care of the entire treatment, coming right from the surgery, chemotherapy, or radiotherapy, or patient requires a follow up also. Post completion of the entire treatment, he needs to be on follow up till 2 years or 5 years, depending on the cancer. That entire thing is done. Recently, we started one newsletter also in oncology. We call it as the scalpel. So where we share few of the insight into oncology for common people. So what is exactly is biopsy, and who requires screening? Should we operate in older patients or not? Like that. Thank you.
Thank you so much, Dr. Karthik, for very insightful session. Uh, we will just take the questions of our attendees.
Yeah.
So one question we have is, I smoked once or twice in a month for almost 1 or 2 years and then
Okay.
stopped. Should that
Yeah.
be a problem?
No, usually if you do not qualify, you don't, as per the thing, you do not qualify as a smoker, but still there is added effect, because so you would be exposed to a pollution, or there may be some family history or a genetic. So it is important you screen the regular screening, regular health checkup is important.
Okay. We'll move to the next question. Can smoking related damages be reversed? Can you talk about the percentage of point reduction in cancer risk as time progress post quitting?
No, no, no. Smoking, whatever the smoking related changes, what we call it as a field cancerization. Probably just to explain, see what you see the tobacco or or smoking, there's some hardening in the oral cavity. You see the skin is very thick. See, those are the irreversible changes. It cannot be changed. Only thing, the patient needs to be under surveillance, what we call it as a follow. There is always a risk of developing cancer. It is like a very fertile soil. Anytime there is a seed you throw, it can grow. It is like that. It is a very fertile land. So even a small amount of toxin that can lead to a cancer.
Okay. So, sir, there are multiple research where they're, developing cancer vaccines. In
Yes.
your experience, how likely is a cancer vaccine in next 50 years?
So there have been few cases where specific cancers, where they have developed cancer vaccines. Suppose today we have a cervical cancer vaccine. That is where we have a etiology is related to a HPV. We call it as a viral human papilloma virus infection. So they have done a extensive research saying that there's some mutations called 16, 18, 31, 33. Those are the strains which is most commonly involved in cancer. So they have developed a cancer vaccines for only those strains. It is not 100% or whole proof saying that patients with vaccination will not develop cancer. It is only for those strains which are the common strains. Probably lung cancer, again, this etiology is multiple. Even though the tobacco, what we see is now with the finer filter cigarettes, a finer thing. What common is the particles are finer and which is reaching the terminal part of the lungs. So it is very difficult to develop a vaccine for a lung cancer. Probably we don't know, probably another 20 or 25 years. But there are so many chemicals, so it is very difficult to develop a lung cancer vaccine.
Okay, moving to the next questions. Sir, what are the cheap and best diagnostic tests available in the market with the high percentage of detection of cancer in the body for a healthy male and female?
Cancer of the lung or general cancer?
General cancer detection test.
There is no specific test for cancer detection. There's no single test which will detect all cancers. It is your just a regular health checkup. Probably a simple health checkup which will cost around 2,500 to 5,000. If
Yes.
there are any abnormality, suppose you have a low hemoglobin. Why is that low hemoglobin? Is it because of iron deficiency, or is it because your diet intake is low, or is it because somewhere bleeding there is a tumor? There is a small, there's some defect in the chest X-ray you do. There is a opacity. Any problems in your the basic health checkup that requires an additional imaging, probably a CT scan, MRI, or a PET scan.
Okay. Sir, one question we have is I never smoked, but I have history of chronic cough, like almost 4 to 5 months per year.
Mm.
Doctor said it's allergy. Can I have a risk of lung cancer?
Yeah, yeah. See, there is, as I mentioned, 30%. Say, generally, we say lung cancer, 80 to 85% we see in smokers. The other 15%, 15 to 20% lung cancers can develop in non-smokers also. Again, a chronic infection, that is also one of the cause for a lung cancer. It requires evaluation and he needs to be monitored. In a long run, if there is sudden increase in the cough, or during the cough he has a sputum with a blood tinge, there is a risk always of developing cancer in a chronic infection.
Okay. If a patient smoked for 20 years, then after he quits, he might still get a cancer in next 20 years. Does it mean the number of years of developing cancer due to smoking depends on the number of year you smoked before quitting?
Yes, we say 20 years of smoking, he can develop cancer till 20 years. It doesn't mean that after 20 years you stop your health screening or something like that. The risk is more in the first 20 years, but still later also you can develop. Again, the annual health checkup is the only way.
If someone has been smoking for a long time and wants to quit, what can they do to avoid getting cancer? What are lifestyle changes are required so that the risk of cancer is reduced?
So if somebody has been smoking and he wants to quit, okay, there are a lot of uh, other thing, nicotine patches we call it. Suppose he is addicted to this tobacco, then we can do that. So once he quits also, he has to be on a regular health checkups, say annual doing a x-ray or a low dose ct scan to screen for a lung cancer. Or if he develops something, some unusual symptoms or a weight loss or a sudden persistent cough, the symptom does not disappear even after a for a longer time, more than a 1 month, that requires evaluation. Regarding the lifestyle modification, again, he should have a healthy lifestyle. At least once after quitting smoking, he should have a regular some physical activity, exercise, and he should do some lung exercises also. So that will help reduce his risk of getting lung cancer.
Okay. Sir, is lung cancer contagious? I mean, what if somebody is beside a lung cancer person and who is already coughing a lot?
See, that is a myth that no cancer is contagious. But in India, what happens is people with cancer can have tuberculosis, and tuberculosis and cancer can coexist. Suppose a patient has a tuberculosis and a lung cancer. So people who are around or the family members, there is always a risk of developing TB. So it's a kind of a lung infection, a chronic lung infection in India. So they can develop an infection, but the lung cancer is not contagious.
Okay. Does cancer spread faster after biopsy? Is this true?
No, that is again a myth. Say, doing a biopsy will not result in a spread of a cancer. It will always help you in aid that what is the type of cancer, and it will also help in the planning of the treatment. If so, it is probably it's less than 1%. There may be a cases like 1%, one patient had did a biopsy, and following he noticed the increase in that. But as per the data and research, doing a biopsy will not increase the chance of spread of cancer.
Okay. So what are the cutting edge treatment options being developed for cancer?
Cutting edge.
Cutting edge treatment options being developed for cancer.
Yeah, now with so much of advances in cancer, so we're from open surgeries, we are going into the robotic and the keyhole surgeries. Suppose now we have patient as a candidate for chemotherapy or a targeted therapy. So we are analyzing the genetic, a molecular level. What are the genetic mutations in the cancer? As per the genetic mutations, which drug is more effective? That is how the planning, and which will also aid us in the prognostic. What is the prognosis of the patient? Suppose we treat with this, so what are the chances like having a complete cure, all those. So now with advanced treatment, molecular level, at the genetic level, we are doing what all the research or what are the genes involved, and based on that we are doing the treatment.
Okay. Next question we have is US has higher average rates of cancer in population than compared to India, but they have higher recovery rates as well, comparing India's mortality rates. Do they have some treatment options that are not available in India, or is it access to healthcare and timely diagnosis issues?
See, it is even though the number of cancer cases are more. So as I mentioned, India is the third after US and China. See, only thing is access to healthcare, and probably the healthcare system is that everybody is insured, and it is important to have a regular health checkup. Probably you do an annual health, as I mentioned, the Average size of breast cancer lump detected in India, it is once it is 3 centimeter or more than 3 centimeter. In the US, it is detected at even a 5 millimeter or a 1 centimeter. So the chances of cure is high. The patients are diagnosed in stage one or stage two. So then the chance of complete cure is more. It is the access to the health system and probably the awareness also. The moment they are, feel something, they go to a doctor, they seek the whatever, unless until it is diagnosed what exactly is that, they are going not going to leave. India, it is more like till it is comes to a point where it is unbearable. So whenever he comes with a, almost like a stage 4 or a stage 3 or stage 4. That is the main reason.
Okay. Uh, Sir, we have one more question. Dear
Yes.
sir, my uncle was suffering from esophagus cancer. It was on stage 4.
Hmm.
After three chemo cycles,
Hmm.
tumor completely waved off.
Hmm.
But in report scan, after a couple of months, it came back. How is it possible?
See, the stage 4 cancer, again, it is a the chance of complete cure is less. So probably you're giving chemotherapy just to control the disease. See what happens again in the stage 4 cancer. Even whatever the chemo drug you are giving, that will be sensitive for only for a period of time. Once that period is gone, probably you take 4 cycles, 6 cycles for 3 months. Fine, tumor will stop growing or it will not. You give a gap of 3 months, or tumor might have started multiplying in a different mechanism where this drug will not affect. So any stage 4 cancers, it is difficult to completely cure. You can just control the disease to a certain point.
Okay. Sir, are there any general warning signs or recommended screening to find the early stages of cancer?
Yeah, as I mentioned, see, is there any lump anywhere you notice in the body, or there's some oral ulcer which is not going, or there is a loose tooth, see, which is persisting for a longer time, or a cough which is persisting for a longer time. See, you need not go to an oncologist directly. Suppose any symptom, you can go to your family physician. Suppose that symptom does not subside or it is persisting for a longer time. Any symptoms which persist for a more time, more than a month, you have a cough, you've been losing weight for more than a month, or there is some loose stools, diarrhea for long time. See, we all might have experience. We had some pani puri, masal puri, we had loose stools, 3 days, 4 days. Then you had curd rice for a week at home. Somehow that is stopped. Something which is persistent for a longer time, that requires evaluation.
Okay, sir, generally, would you recommend having any specific test for cancer annually?
So annually do a regular health checkup. Any master health checkup is fine,
Okay,
and a examination by a clinician.
okay,
Just a physical examination by a clinician and doing a master health checkup, and to keep a track of what all the records. Say, last year it was so, my weight was so, hemoglobin is there any decrease or increase in the pattern you see? So if there are any changes, those are the things which needs to be evaluated further.
okay. How one should keep their lungs healthy?
Just to avoid exposure, I mean the air pollution, avoid smoking, quit smoking. It's always very difficult to quit smoking. At least start a control pattern, decrease the number of cigarettes, slowly try to quit smoking, avoid pollution, do some have some healthy diet, good physical activity, and some breathing exercises, which is more important.
Sir, what causes water retention in the lungs and how to reduce it?
So there are a lot of reasons why the water develops in the lung. So the only thing, the cause has to be evaluated. Sometimes there may be a problem in the heart also. If there is a pumping, if there is a less pumping, then that also causes retention of water in the lung. Or there may be a low protein in the body. Those are also causes water retention in the lung. Some infection which causes again water retention in the lung. Cancer can causes cancer of the some other site can causes water retention in the lung. So the cause has to be evaluated. As per the cause, the treatment has to be done.
Okay. Sir, there is one question. I am 33, have a little lump near the chin for long time and no family history of cancer. Please advise.
Little?
Little
I
lump. Lump.
What is that little lung?
I
Small
have a
lung?
little lump near the chin for long time and no family history of cancer. Please advise.
I didn't get that actually. What is the little?
Dr. Karthik, she means
Yeah.
lump, a node, a lump kind of thing.
Okay. Okay. Fine. So that needs to be evaluated. Actually, usually the long-standing some infection, usually we say is the sinusitis or cold, can have a small node just below the chin. So, but still, it needs to be physically examined by a doctor, and to say that there's nothing to worry.
Nowadays, there is one vaccine for kids called HPV 1, 2, 3. Is it
Huh.
safe to go for the vaccine for the kids?
See, that is usually advised for from the age of 16 to 21, mainly for the females. They say it is the HPV vaccine, quadrivalent vaccine. That is what HPV 16, 18, 31, 33.
Can PFTP be a good diagnostic test for lung screening or lung cancer?
So, PFT is not a screening test for lung cancer. It will just tell you the what is your lung capacity. The main screening test is always a low dose CT scan.
Uh, Suman, are you taking the next question?
Hello.
Yeah.
What is the latest tech for cancer treatment, or is Ayurveda or home remedy to reduce risk of cancer?
See, once the cancer is developed, so it has to be treated as per the cancer protocol. It may, if it requires surgery for early stage, surgery is the treatment. If it is an advanced stage, chemo or radiotherapy is the treatment of choice. Or it is an advanced stage where the palliation, where the intention is not curative, just to control the disease. See, Ayurvedic and the other remedies might help you to prevent cancer or in an early stage or it is before the cancer. It may be some preventive aspect. Not once the cancer is developed, you cannot opt for a Ayurvedic or some other form of treatment.
Okay. Sir, can cancer still occur after completion of chemotherapy?
Yes. They say even once the treatment, suppose if it is an early stage, we say the cancer is completely cured. In spite of this, the patient is asked to follow up for every 3 months till 2 years. Once he crosses the 2 years, the risk is slightly less. We say every 6 months for till the next 5 years. So he crosses 5 years, then we say okay, but still he can have a risk of developing cancer. But usually the 5 years is the time till we follow up the patients.
Okay. Whenever I go for full body checkup for parents, they only do the blood test. Will that be enough to identify earlier, or do we need to do a specific test for cancer?
No, it's along with the blood test, you need to do a chest x ray, ultrasound of the abdomen and pelvis, and a mammography for females more than 40 years. This is a basic thing along with the blood test.
Okay, sir, we have two more questions.
Yeah.
I was diagnosed with lung cancer stage 4 in January 2025 with about 4 centimeter of module on lunch and prial effusion. Doctor suggested not to go with the surgery and start with chemo. After 6 cycles of chemo, the tumor is reduced to less than 1 centimeter. Going through maintenance and targeted medicine, Tagreso, will it go away completely or should the treatment be taken for the lifetime?
See, whatever as per the treatment, he has undergone a correct treatment. It's a stage 4 with a 4 centimeter nodule and a pleural effusion. So surgery is not the treatment of choice. So chemotherapy. So he had a very good response. We can say very good response after the chemotherapy, which has reduced to 1 centimeter. Again to continue with the maintenance therapy. So he has to be on a lifelong treatment on maintenance. Other thing is what we call it as a we give a drug gap. Suppose the disease is stable for more than 3 months or 6 months, we give a drug holiday. We call it, we stop the chemotherapy or a maintenance drug for a 3 months or 6 months, and we reassess with a PET scan, saying that is there any increase in the size or not. If it is stable, then it can be, he can stop the maintenance therapy or he has to be on a lifelong maintenance therapy.
Okay. One last question. I have had little chest pain for almost 2 years now. The pain is not regular and in very little, but I feel it only when I tighten my chest. I have gotten treatment by multiple doctors, but everyone has different take on it. Some say bronchitis, some say normal chest pain. Could this be a serious problem?
We require a little more. What is the age of the patient? Any history of smoking or habits in the past or present? So if he or she is not in that risk factor, probably in an early 30 or 40, and no history of smoking or any habits, so then probably just annual health checkup is fine. Suppose there is a history of smoking and also the risk factors are there, then she requires further evaluation, probably a CT scan or further checkup by an oncologist or a
Uh,
pulmonologist.
Doctor, they have replied that the person is 27 and has no history of smoking.
No history of smoking. Yeah, better to be shown to a pulmonologist if the pulmonologist has not seen. So better to show it to a pulmonologist.
Okay. We have taken all questions
I
of
think there's
the
just one
attendees.
question in chat that what are the best physical exercises or breathing exercises that you would recommend for general health?
So any form of, I mean, the what we call it as pranayama is the good, or some even like a cardio is also 20 minutes of cardio is the ideal thing for the breathing lung exercises, lung and heart both. They say even 8 minutes of daily cardio is a very good thing, minimum of 8 minutes.
Thank you, doctor. And just like one personal question. Okay,
Yeah.
if someone has lupus, but it's in remission phase, uh,
Okay.
and had ILT, which is also in remission phase, is there like
Oh,
some extra diagnosis or measures one needs to take?
need to be on a follow up. That's it.
Yeah, that's like the follow-up which they have told, right?
Yeah.
Yeah.
So usually the risk is less. It's more of an autoimmune going into a cancer, or the chances are less, but still it needs to be on a follow up. What was the medicine prescribed for the
Prednisolone,
prednisolone? Okay, fine.
90 mg, like
Nine.
90 doses, 3 years.
Oh, oh, okay, fine. Need to be on follow up. That's it.
Yeah. Thank you so much.
Yeah, thank you.
Uh,
Thank you so much, Dr. Karthik, for very
Yeah,
insightful session.
yeah.
We almost answered all the questions of our attendees. Also, this is for all the users. As a special thank you for being part of today's session, all attendees will receive access to a free risk assessment. Okay, along with an exclusive 60% discount on a preventive cancer checkup with home sample collection. There is no action required right now. Just watch out the feedback email after this webinar where you'll be able to claim this benefit. This initiative is powered by Aura Health in collaboration with IMT Care, and we are happy to make it available to everyone attending today. Thank you so much. Thank you so much, Dr. Karthik, once
Yeah,
again.
yeah. Thank you.
Thank you.
and special thanks to Sparsh Hospital as well.
Yeah, yeah.
Yes.
Thank you very much.